I do laparoscopic surgery, and we offer a wide variety of surgical procedures laparoscopically. Predominant part of our practice is bariatric surgery, which is a surgery for obesity. There we offer a range of procedures including the gastric bypass, laparoscopic gastric banding, sleeve gastrectomy, and some revisional surgeries.
I had bariatric surgery, specifically gastric bypass surgery with Dr. Vohra 2 years ago, and since then I have lost 190 pounds. I was actually a poster girl for a heart attack waiting to happen. What really pushed me to make the final decision for gastric bypass was the fact that I had hypertension, which was treated with 2 medications. I had diabetes, I had sleep apnea, I had asthma, which required a number of medications. I probably had more medications than your average 80-year-old person. I chose Dr. Vohra for a number of reasons. I was very pleased with his staff. His staff is incredibly supportive, from the ladies that make your appointment to people at the bedside to Dr. Vohra himself. And his knowledge, his expertise are what every person wants in their surgeon, and his bedside manner was exceptional for me. See, these are the pants, and I could probably stand in one leg right now with all the weight that I've lost.
My doctor recommended Dr. Vohra, and their office said their staff was very professional and courteous. I found this to be true. For adjustments, it's a very simple procedure. You go in, they check and see how you've been doing for the month. They weigh you. The adjustments are painless. The needle goes in, they inject a saline solution, and it's done. Very simple, very straightforward, easily adjustable. Had it on a Thursday, was back to work on a Monday morning. It was nothing. I mean, all the fear and the anxiety that I had built up was all in my own mind. And had somebody told me that, it may have eased me a little bit. And of course, they tell you that in the office, but that's not somebody who experienced it. I went through it, and I'm telling you it's nothing. And everybody who's come out of it that I've told it's nothing has agreed with me. They said, David, thank you for advising us to do this. And they're looking forward to putting their lives back on track.
My girlfriend and I had decided to go to Dr. Vohra because he had performed surgery on my girlfriend's friend, and she said that the staff was great, the surgery went well, and even after there was a lot of support. And those are key components when you're choosing a doctor. You want to make sure that they have a good reputation. I also did a lot of research on the website. I did visit one doctor before Dr. Vohra's office, and when I went to see Dr. Vohra's staff, I felt more comfortable there, and so I chose to continue with my pathway to surgery. Wake up in the morning, and it was the first thing I would think about is my weight. I eat to live, not live to eat. Yes, that's great, because now when you look at the scale, you can't believe that you're at that weight, but it's even better when I put on clothes from a size 22 to a size 8, 6. It was great because I was going from size to size to size. I had skipped completely over 10. And I thought I was going to stop at 14, but I kept going.
You can't even tell where the incisions actually are. They're really, really small. I think the scar on my arm is actually bigger than my incisions. You don't need to worry about any plastic surgery down there or anything like that. Once I had the surgery, I just felt great. And once I've lost all the weight, now when I get on the plane, I'm able to fasten the seatbelt without having to ask for that extension. And also, I'm able to cross my legs and still bring down the tray table. I love everything about it. I'm more energetic. I go to aerobics. I'm able to run around with my dog in the backyard and things like that.
I wore a size 56 pants. They were tight on me. These were tight on me. And now I bought a pair of Lucky jeans, and they're 36. I had the gastric bypass procedure. I lost 235 pounds. So that was 451 pounds when I had it. And now I weigh about 216 pounds. It definitely changed my life. I feel a lot better. I could do my job a lot better. I could buy clothes off the rack in a normal store. I can go in an airplane seat. I can get in a sports car. I can play golf again. Dr. Vohra was good. He was real professional, but he knows what he's doing. He gets it done. And that was it. He knew what I had to expect, and he didn't sugarcoat it. He did it. I recovered, and that was it.
He just said, no, it'll be a quick recovery, and you'll be back good as new, no more pain, and it was just really reassuring from him. And the incision is so tiny in the belly button, you don't even really notice it. It was just really quick, and he sent me to South Nassau to get my pre-surgical testing, and his office did everything. I was very relaxed through the whole thing. I never was worried or panicked. I would absolutely recommend Dr. Vohra's office. For surgery, how can you say it's like a good experience, surgery, but it was a pleasant surgical experience, I guess.
I've learned over my few years after surgery is it's a great tool. What I tell everybody when I come to the support groups, I try to go as often as I can, is that it's only a tool, and the main thing is listen to what they say. I listened to what the doctor said, I listened to what the program director said, I listened to what the nutritionist said, and the weight fell off me. I mean, I lost 185 pounds within like 6-7 months. It just came off like, I don't know how to describe it. I still don't fathom it. I look at pictures, I said, no, this is not true.